What would happen if you never brushed your teeth your entire life? Day 1, plaque starts building immediately. Your mouth becomes a breeding ground for bacteria as acids attack your enamel non-stop. Your breath turns foul and a sticky film coats every tooth surface within hours. Week 2, the bacterial colonies multiply exponentially. Your tongue develops a thick white coating. Your gums become inflamed and tender, and every time you eat, food particles feed millions of bacteria, producing more acid that eats away at your teeth constantly. Month 3, forget white teeth. To survive the bacterial invasion, your gums start bleeding and receding. Your teeth turn yellow, then brown. Cavities form rapidly in multiple teeth, and your mouth becomes a constant source of throbbing pain and infection that radiates through your jaw and up into your head. 6 months, tartar has hardened into cement-like deposits. Your gums pull away from your teeth, creating pockets where bacteria thrive. Your breath is so toxic people avoid standing near you, and the pain keeps you awake at night as nerves become exposed to air and temperature. Year 1, gingivitis has evolved into full periodontal disease. Your gums are swollen, purple, and bleeding constantly. Multiple cavities have reached the inner pulp of your teeth, causing infections called abscesses that swell your face and leak pus into your mouth, creating a perpetual, disgusting taste. Year 2, you are now in dental crisis. Relentless decay has rotted multiple teeth down to the nerve, causing agony that radiates through your entire jaw and up into your head. You're not smiling anymore, but compared to year 1, you're living with abscesses, exposed roots, and fractured teeth constantly. The infection spreads into your sinuses, causing chronic headaches and facial pressure. Year 3, teeth start crumbling and breaking apart. Your bite becomes uneven as teeth shift and loosen. Eating anything crunchy is impossible. You survive on soft foods and liquids, while your jawbone begins deteriorating from the chronic infection, eating away at the bone structure that holds your teeth. Year 5, your teeth start falling out one by one, chewing ability gone. You lose your front teeth first, then molars as the bone loss accelerates. You can only eat mashed or liquid foods. Your face changes shape, collapsing inward as bone mass disappears, and every meal is a painful, humiliating reminder of the irreversible damage. Year 7, the bacteria from your mouth enters your bloodstream regularly through the damaged gum tissue. This causes systemic inflammation throughout your entire body. Your risk of heart disease skyrockets as oral bacteria attach to damaged heart valves. Your immune system is constantly fighting infections that originate in your mouth, spreading to other organs. Year 10, if you haven't died from sepsis or heart complications, your mouth is completely destroyed. Your jawbone has deteriorated so severely that your face looks sunken and aged decades beyond your years. Most teeth are gone, leaving only broken stumps and infected roots embedded in diseased bone tissue. Year 12, the cascade of health problems is overwhelming. The chronic inflammation from oral bacteria has contributed to diabetes, cardiovascular disease, and possibly even dementia as bacteria travel through your bloodstream to your brain. Your quality of life is destroyed by constant pain, inability to eat normally, and social isolation from the horror of your appearance. Year 15, survival itself becomes questionable. Every infection is life-threatening. The bacteria from your mouth continuously seeds your bloodstream, causing endocarditis, where bacteria form colonies on your heart valves. One severe infection could trigger septic shock. Your body is in constant inflammatory crisis, and organ damage accumulates from years of fighting infections. Year 20, if you're somehow still alive, you're a medical catastrophe. Your mouth is a gaping wound of exposed bone and chronic infection. You can barely speak clearly. Eating is torture, requiring liquid nutrition. Your heart is damaged from repeated bacterial attacks. Your kidneys struggle from chronic infection and inflammation. And every day, your body fights a losing battle against the consequences of 2 decades of unchecked oral disease that has destroyed not just your mouth, but your entire body from the inside out.